Hi, welcome to today's expert chat. My name's Gail. I'm an editor here at Understood. Today's topic is ADHD and anxiety. Joining us is Ellen Braaten, the director of the Learning and Emotional Assessment Program at Massachusetts General Hospital and the associate director of the Clay Center for Young Healthy Minds. Hi, Ellen. How are you?
Hi, how are you?
Good, welcome. Why don't you spend a minute introducing yourself to everybody?
So, as you said, I'm the director of the Learning and Emotional Assessment Program here. My area of clinical work is in pediatric neuropsychology, particularly assessing kids with learning and emotional issues such as ADHD, dyslexia, other learning disabilities, and autism spectrum. And as part of my work, I am interested in certain areas of functioning like processing speed and attention and executive functioning.
Terrific, thanks. Just a reminder to everybody, if you have a question, please just put it in the chat box. If you don't have a question, just say hi and let us know where you're from. We love to know who's out there. Okay, Ellen, let's jump in with sort of a foundational basic question, which is, what is the difference between anxiety and anxiety disorder?
Well, most of it's the intensity of the experience. So anxiety is something that's experienced by everyone who's ever lived. We all feel anxious about different things, and oftentimes it's very appropriate for us to feel anxious in certain situations. And anxiety disorder is when anxiety sort of takes over, has a life of its own, to the point where we can't function in situations where we should be able to function in. For example, we get a little anxious when we have to take a test. That's a good thing. It helps us, in some ways, even focus. Just the right amount of anxiety can help us kind of focus and get ready for that test. But someone who has test anxiety or an anxiety disorder, that anxiety is so much that they can't actually do the test. And that's just one example. Anxiety disorders can take over. It can take a lot of different forms. But it really means that the anxiety itself is interfering with our basic ability to do things in life that we should be able to do.
Great, terrific. We have a question here from our community, and if you haven't already joined and would like to join the community, come check us out at u.org/community. So here's the question, Ellen. How common is it for kids with ADHD to have anxiety disorder?
Outside of ADHD, are you asking just in terms of the regular population?
Yeah, I think a parent wants to know how prevalent is it among ADHD kids to also have an anxiety disorder.
It's very common, actually. In fact, some people might say it's more the rule as opposed to the exception to the rule. So depending on the studies, it can be anywhere from 11% of kids with ADHD have anxiety up to almost 50% of the kids might have a lifetime prevalence of having anxiety along with their ADHD. So it's really pretty common. Now, that doesn't mean that a child with ADHD always has an anxiety disorder, but it means that it's quite likely at some point in their life they may have what we call a comorbid or a co-occurring anxiety disorder along with ADHD.
Well, that actually raises a question for me, which is it ADHD that leads to an anxiety disorder, or do these kids simply have both?
Well, it's probably more likely that they have both. There definitely are some studies that show that ADHD does not cause anxiety disorders. But some people might argue that it actually does cause anxiety. And once you start to feel anxiety is one of those things that can take on a life of its own. And so even though there's not specific evidence that shows that ADHD causes anxiety disorders, like I said, some people might argue that the relationship is more than just something that just happens to co-occur. So when you have ADHD and you're not paying attention and the teacher calls on you in class, all of a sudden what happens is you get anxious because you weren't paying attention and now everybody's looking at you and you don't know the answer and you don't know what just happened. So those sort of experiences can lead somebody to kind of feel anxious a lot of the time.
Right. So is there sort of a wiring component that, that occurs in the brain, or a genetic component, or is it just sort of something that gets triggered, anxiety and ADHD?
There's not a definitive answer to that question, although it does seem to probably be that there is some kind of a genetic link, meaning that when ADHD is transmitted genetically, for many people, it's co-transmitted with anxiety, or in some people, other disorders as well, but that there probably is a genetic link between both of those things that are transmitted. And then again, it just like it for some researchers might just say that it's just when having one of those conditions increases the probability that you might have another one of those conditions. So we don't really know if it's genetics, if it's environment, or a combination of the two. It's probably in most people a combination of the two.
Great, thanks. It seems like ADHD is often misdiagnosed as anxiety and vice versa. Why is that?
When you look at the two disorders and you look at the criteria for anxiety and ADHD, a lot of the outward signs, especially in kids with the more inattentive subtype ADHD, there's a lot of overlap in how kids look. Now, not an overlap in how they feel, but an overlap in, for example, both kids with anxiety and ADHD might look inattentive. They might stare out into space a lot. They might be afraid to kind of answer because they can't organize their thoughts very well. When you look at the actual criteria like that, and the main criteria is looking at is somebody paying attention, you might just think that, oh, well, they have an attention problem. Or vice versa, they may have an anxiety disorder. I kind of find that more often than not, ADHD is diagnosed instead of anxiety disorder. So, for example, kids will more likely be misdiagnosed with ADHD when they have an anxiety disorder rather than the opposite. Just because I think teachers are more aware of the signs and symptoms of ADHD than they are of an anxiety disorder, how that might look in a classroom setting.
What can parents do then to make sure that their child is properly diagnosed? Is it something that they need to get a second opinion on from the beginning, or just something to keep an eye out for in case they see different kinds of symptoms that might be anxiety? What's the protocol for parents?
Well, that's a good question. The best thing is always to get more information. And there's a wide variety of how much information you can get. You can talk to your pediatrician and they can help you tease out some of these symptoms. You can go to a psychiatrist. You can do what we call a psychiatric evaluation, where where they would ask a lot of questions about different sorts of symptoms and different kinds of environments. And then you could also get a more comprehensive evaluation, a neuropsychological evaluation that'll look at cognitive functioning and executive functioning and things like working memory and organizational skills, to see if perhaps that those sorts of skills are what's causing the inattention and the problems interacting in the environment. The other things that parents want to think about is that the big difference between ADHD and anxiety has to do with the emotions behind the behaviors. So kids with anxiety have worries, they have fears, they have things like stomach aches and headaches, a lot of psychosomatic issues. So a parent can even just look at that and ask more about that in their child. So they're inattentive. Are they inattentive just because they're having trouble paying attention? Or are they having trouble paying attention because they're worried, they're consumed about worries in their head? They're worried that mom's going to be on time to pick them up after school. They're worried about the bee that's buzzing around outside the window as opposed to being distracted by the bee because the bee is just really interesting to look at. So that's the sorts of things that parents want to look at, is what's the underlying emotion? Is there an underlying emotion underneath the behaviors? And the other thing that's more common in kids with anxiety than with ADHD is kids with anxiety tend to not want to do new things. And that's not typically true for kids with ADHD. So kids who are anxious don't want to go on sleepovers. They don't want to even go to grandma's house because they're worried about things. So that's, if you're just as a parent trying to figure this out on your own, those are the sorts of things to look at to help you tease that apart.
Great. We have a question, a couple of them actually, coming in about ADHD medication and anxiety. So one of our users wants to know whether medication can actually increase anxiety in kids with ADHD.
It absolutely can. In fact, it's one of the more common side effects of ADHD medications. Now, I do want to say that most ADHD medications work very well, and for most kids, they do not have associated anxiety, but it can increase symptoms of anxiety in certain kids. So one of the things you want to be careful to do is when you get a medication evaluation with your pediatrician or with a psychiatrist, if you're worried that your child might be anxious, you want to make sure to tell them that, because they're going to be more cautious about the kinds of medications they're going to think about for your child if there's a comorbid anxiety, or even if there's just anxiety in your family history. So for some kids who have ADHD, you put them on medication and they didn't have anxiety before, but now they sort of have that nervousness, especially sometimes as the medication is wearing off at the end of the day, or for some kids, it's when they first go on the medication, they can feel a little bit more anxious. And part of it is it can make your stomach a little bit, nervous. And that can sort of lead you to kind of interpret that as symptoms of anxiety. So you want to make sure that if there's a family history of anxiety, that you let your prescriber know that.
Terrific. One parent wants to know, what are some ways that their child can manage or block out anxiety when they need to take tests at school? And, which raises, I think, another question, which is, are there ways you can teach your child to cope with anxiety?
There are great ways to cope with anxiety. So I think I heard two questions there. One was related to test taking,
Yeah.
and the other was kind of related to just anxiety in general. So in terms of test taking, if it's there is sort of an optimal level of arousal for anxiety. So, for example, when we're taking a test, that's a great example of the optimal level of arousal. When we're taking a test, to not be anxious at all is actually not what we're striving for, because we don't do as well on those sorts of things when we're not anxious at all. So make sure that if you're working with your child on this, you're trying to help them, to tell them that, don't be anxious. This isn't anything to worry about. That's actually not true. A test is something to worry about, but it's not something to worry about too much. So what you want to do is you want to help your child figure out what's just that right amount of just being a little bit anxious that kind of revs you up. So helping your child interpret that feeling of anxiety as in some ways a feeling of heightened excitement, of sort of an appropriate way of kind of coping with a test or something new that, okay, we need to be ready for it. That means we might feel a little charged up. And to sort of label it in that way is very helpful for your child. Now, for a child who really has a lot of problems with anxiety and test-taking anxiety, you can always ask for things like a 504 plan so they can take their test in a quiet location. And sometimes schools will allow you to do that even without a 504 plan. So you can take, if the anxiety symptoms are so significant, you can go ahead and do something like that. The bigger question, though, about treating anxiety symptoms with or without ADHD is there cognitive behavioral treatments are very good at treating symptoms of anxiety. They're extremely helpful, and they're really dependent. There are a number of different techniques that are sort of used for many types of anxiety, but it's really very much geared towards your child. What do they need? Do they have more ruminative thoughts that they need to kind of get control of? Is it more sort of a psychosomatic kind of feelings of anxiety? So the therapist will use cognitive behavioral techniques to treat your child's specific symptoms. And part of the treatment is actually identifying those symptoms. Once we kind of identify what is it that's making me anxious and how does it make me feel, already we start to feel better. So they're definitely wonderful treatments for this.
Well, there's another question actually that kind of ties into this, which is what about cognitive behavior therapy for kids with ADHD and anxiety? Will it work for both?
It does work. And there are a lot of, it's really only been more recently that techniques like cognitive behavioral techniques have been used for kids with ADHD. So there have been a number of studies done over the last 5 or 6 years that have really shown that some of those same techniques that we've used for things like depression and anxiety are actually very helpful for kids with ADHD. So seeing somebody for cognitive behavioral therapy who has expertise in both ADHD and anxiety can be very helpful. And there are a lot of professionals who are becoming more adept at looking at both of those behavioral disorders as one. So
terrific. When we're talking about medication, what do parents know about using both ADHD medication and anxiety medication? Is it safe? Can they work well together? Is there anything that they should know about in advance?
Yes, this is a really good question. Most psychiatrists will suggest that if a child has ADHD and anxiety, that they should treat whatever is more significant. So, for example, if you've got a child who's extremely hyperactive and a little anxious, the psychiatrist will most likely try and treat the hyperactivity, the ADHD symptoms before the anxiety symptoms. If a child is paralyzed by anxiety, they'll usually treat the anxiety symptoms first. It's really a lot more art than science. But children with both ADHD and anxiety can be treated quite well with medication. It might take a while. In other words, it might not be the one medication might not work for both. You might try something and sometimes parents can feel very discouraged about the fact that it's not working or it actually made the anxiety worse. I think being very patient with that process is good, but there are definitely medications and sort of medication cocktails is kind of what sometimes you'll hear psychiatrists use that word, of using different sorts of medications to treat both can be very, very useful.
Do you find that when kids who have both first start taking ADHD medication, once it's fine-tuned and jitteriness starts to subside, does the ADHD medication often reduce anxiety? Is that something the medication does? Or do kids themselves find themselves less anxious when their ADHD symptoms are managed?
Well, that's a good question. We've been talking all this time about how medication can increase symptoms of anxiety, but actually in a lot of ways, just like you said, the symptoms of the anxiety might go down because you're just doing better in school. So all of a sudden you're turning in your homework. You're remembering to do things on time. You're listening to what's going on in class. Medication can help with all of those things. So if your anxiety is very much related to the fact that you're always nervous about being late, not being on time, not getting things done on time, not listening, the feeling of being more in control can actually help you feel less anxious. So yes, even though most people would say the medication itself isn't leading to fewer feelings of anxiety, you could say that the medication, because it's treating the ADHD, the impulsivity, the hyperactivity, the inattention in particular, can make someone feel a whole lot less anxious because you're just feeling more in control.
Ellen, how would you suggest that parents talk to their child about ADHD and anxiety? I would imagine that a lot of kids don't want to hear that they have two problems, let alone one. Is there a way that you recommend talking to kids so they understand and feel more comfortable about what's going on?
Yeah, I think in answering this question, I think getting more information from your child in a way is very helpful to talk to them. So depending on the age of your child, you might want to ask more questions than actually give more information about. And then use that information you're getting from them sort of label it as feeling inattentive or anxious. So, for example, you might say to your child may know that they have an attention problem or problems paying attention. And then you might want to talk to them. Well, how does that make them feel? Like, let's say, they also have a comorbid anxiety, but you don't want to, again, kind of like what you were saying, like kind of burden them with this additional label, but to just kind of talk about what it feels like to have inattention in the classroom and sort of say, oh, it would make sense that anybody would feel more anxious like that. Is that how you feel? So I think just having a conversation about it, as opposed to most kids feel like this, or this is what anxiety is, because it's so individualized to a child that I think it can be so helpful for them, for you to listen to actually what it feels like to be them, as much as it is for you to provide them with information. But I think providing them with information about it's normal for lots of kids who have attention problems to feel this way, even when you don't have attention problems, and you find yourself at a time in life or in a certain situation where you weren't paying attention, it's normal to feel anxious. And so I think normalizing it for them, normalizing it for in the big picture that many people would feel that way, and that it's really common for lots of kids with attention problems to have anxiety, I think makes them sort of feel relieved that they're not that different. And ultimately, that's what kids really want to know, is that they're pretty much okay.
Right. We have a question about DBT and whether it helps with ADHD and anxiety. So I'm hoping you can explain a little bit about what DBT is, and then answer whether you think it does help with either or ADHD and anxiety.
Now, I'm just having a little bit of trouble hearing you. Did you say DBT?
Yes.
Yes. It has been found to be effective for lots of kids, and it's really it's a skill building kind of approach that helps people kind of feel more in control. I mean, that's how I kind of think of it. I would be interested in hearing what the person was asking about in particular, what sort of like the age of the child or the age of the adolescent, because it kind of depends. I kind of think of it as a program that's much more for older sorts of kids. So
the user was talking about a teen, and so I don't know how old a teen, but do you think, and just for users to know, DBT is dialectical behavior therapy. So when you're talking about a teen who's been struggling with anxiety and or ADHD, do you feel like, as we're talking about a high school kid, a young adult starting college, is that something parents should look into or ask about?
Well, I think, so DBT is one of those things, again, that started in a different area of psychology and is now being applied to ADHD. But the research is it's a very much a skill building approach to where people take responsibility for their own behaviors. And so it was used more for people with kind of like what we call personality disorders. And for people kind of put responsibility out on other people or didn't see their own role in the problems that they were having in relationships. But the problem was mainly in the relationship. But you can kind of see as in ADHD taking more responsibility or trying to figure out what is my role in this situation versus what is somebody else's role, I think can be very helpful. I do find that it really is more of a young adult, teen to young adult into adulthood kind of treatment program, because it really requires someone to have some insight into their own behaviors. So I think it's a great idea. I mean, you'd want to make sure that it's somebody who knows how to apply those things to an ADHD population, an ADHD child, as opposed to somebody who, again, it's more of a relational problem. So I think it has been found to be effective, and the techniques are great just in general. Mm-hmm. So.
Oh, terrific. Great. Thank you, Ellen. That's all the time we have today. Thanks so much for joining us. I want to remind everybody that our chats are archived at u.org/calendar. You can also RSVP to upcoming chats there. And again, thanks again. Have a great day.